Hello and welcome to the Sustainable Healthcare Podcast. In this episode, we are streaming live from the People's Meeting for the Climate in Middelfart. And I'm really excited to have Rasmus Revsbeck with me in the studio today. Rasmus is working with the Center for Sustainable Hospitals in the central region of Denmark. And he's an LTA expert, so he's a life cycle assessment expert. And I'm really looking forward to diving into that and picking his brain on what we can learn from him when we are decarbonizing the healthcare sector. So the Sustainable Healthcare Podcast, we exist to share our learnings from Green Innovation Group on decarbonizing the healthcare sector. It's presented by us in Green Innovation Group. My name is Frederik Van Deurs. I'm the CEO in Green Innovation Group, and I'm really excited to welcome you, Rasmus. Thanks for coming.
Thanks for having me.
If when we're looking at the healthcare sector at large, depending on who you ask, it's emitting between 4 and 6% of all the global CO2 emissions.
Yeah.
So we're looking at quite a beast. It would be the 5th largest country if we are to believe these numbers, and the demand for healthcare services is only going one way as global populations are increasing, and they also have more money available to spend on healthcare. So before we dive into the practical solutions that we can use to address this problem, can you tell us a little bit about yourself, where you are, and what is the Center for Sustainable Hospitals?
Yeah. Well, my name is Rasmus, as you said. I have a master's in environmental management and sustainability science from Aalborg University here 5 years ago, and I've been working the last 3 years for the Central Denmark region. The Center for Sustainable Hospitals was developed during that time from being a project to being a center. It started with 2 people 2 years ago, and I think we're 12, 15, something like that, depending on the day now. So really, we rose, and we have sustainability days where we have, I think it's 36 people now in the Central Denmark region who work with sustainability, environmental sustainability, as their full-time job.
Super cool. Super cool. But you also had a lot to do, right?
Oh yeah. It's crazy what we do, and you can say we are we are user of stuff. We buy stuff. We are consumer of stuff. So that means that in relation to many other companies who produce their own stuff and can really control what they're doing and the processes and where they buy from and so on and so forth, we are consumers. So we buy a lot of different stuff, and we are also a public entity, so we also have to, work within certain rules. We can't buy the most expensive thing just because it's sustainable, because we have a budget to fulfill and so on and so forth. And secondly, as with everything else healthcare, we cannot really just stop doing it because it's not environmentally friendly. We are not Plastic Co. Toys over here who doesn't fulfill a society bearing function. We have to do it. So we cannot, neither can we just shut down our hospitals for a couple of years, while we work it out and so on and so forth, and then we can open them up as
we
greens.
can give it a very long think.
Yeah, exactly. No, so we have to mend the fences while we're running, and that really sets the tone for a lot of stuff we're doing. We're also quite large, so I have 30,000 colleagues, so to say. So we also have to be pretty sure about what we're doing. So I cannot.
The 12 of you kind of have to herd those 30,000 people around and making sure they make more sustainable choices in the hospitals, or how does it work? What's your actual? What does the tasks look like? What's the result from the work?
Well, different people, different jobs. I started out being a jack of all trades because there were 2 of us. Really talking about the people who are doing the new waste plan, talking to the people who are setting the targets, talking to the people who are, how do we count this stuff and so on and so forth. My job now is only the counting bit, really. But I have colleagues who have meetings with the nurses and the doctors who are doing it, the clinicians. We are all different kinds of people. Some of us have healthcare experience or healthcare education, so they know something about what they're doing. But otherwise, we can't tell people what to do. I have to go there and ask them, are you doing something now that you think is bad? Because generally people know what they think when they do something that is environmentally detrimental, and then we can work together with them to make it better. But it
sounds almost like anthropology you're doing right there.
Don't say that, then I don't want to do it. No, but it's about working with people because they have the solutions, because they're the only guys who know what they're working with. I cannot go to a heart surgeon and say, hey, this you have to do it like this instead. I can say, this thing here you have, that's pretty bad. Is there alternatives? And then he can come up with the alternatives. So you have to work with people.
Are there certain areas that, I mean, now your academic reference is also in the realm of life cycle assessments, where you're figuring out from each item that is inside, let's say, an operating theater, you figure out what is the environmental footprint from each item. Is there, if we're looking at a hospital as a whole, is there one public enemy number one in terms of carbon emissions that we should address first? Or is it a very complex setup?
I mean, it is a very complex setup, and we use more than 150,000 different types of objects every year.
150,000 different objects.
Definitely, and perhaps significantly more than that, but it's a bit hard to figure out when people just buy stuff. So you will not find, that one panacea for the environmental issues. You will not find that one thing that we fix this, we're good. The biggest things we find will fix maybe 1% or 0.5% of our emissions.
Okay, so that's the margin that you're looking at.
Really good stuff.
Okay.
But when you then bunch stuff together and say we want to go from single use to multiple use, there we can save a lot, because that's suddenly a lot of stuff. You can go from single use scissors, suturing sets, whatever, into a multiple use.
And if we're latching onto that single use and multiple use, I'm familiar with a lot of different studies that have compared the life cycle assessment from a single use scissor and a multiple use scissor, and there I think it's relatively straightforward, because it's a scissor, and if you wash it, it should work again. So do you have a way to review how complex can the instrument be before it stops being a no-brainer?
We haven't found the bit where it stops being a no-brainer. We looked at the very simple stuff, so like the scissor, the suturing set, the prongs, the tongs, and whatever, and they're simple. You can just stack them in the washer and away they go. And we looked at some very complex stuff, so bronchoscopes.
What is a bronchoscope?
A bronchoscope is the video camera you stick into people's lungs. So scopes are just the cameras that goes into whatever hole you can find, and the bronchoscopes is the simple one for the lungs. Okay. And we looked at those, and we're close to a break even, but it comes down a lot to use. So we have a lot of multiple use bronchoscopes that people don't take care to use, and they have to be washed every week. So people don't use them, so we just wash a clean one. So it's in the closet for another week. So, if we optimize that so we don't have any wastage, we still have a good case for the multiple use bronchoscopes, definitely.
So let me just get that straight. So we have a surgical camera that you use for long procedures.
Not just for looking in.
Looking inside lungs.
So I come in the ER and I'm coughing and I'm whatever, then you stick down one of those to see what's going on.
Okay. So, and then either I could have a single-use device that would be very costly and both in dollars and CO2, or I could choose a multiple-use one that I can wash. The problem right now with the multiple-use one is that it's being washed even though it has not been used. Is that correctly understood?
Yes, partly. Of course, there is also a lot of other parameters, and we can work with some of them, but we optimized our way of working with these things to work with a single-use one. We optimized for the most efficient use of people rather than products. And using discard is just much simpler to work with in those cases. Yeah.
So it's also something where the healthcare system at a global level has also been developing a demand for single-use devices due to the pressure on the clinicians. So that has also led to R&D investments that are going into single-use devices. So one thing that I'm really curious about is when we're looking at that ecosystem of suppliers as well, how might we make sure that everyone gets on board so it doesn't become a battle of single-use versus multiple-use, but something with a common ground where we can also discover and figure out the best solutions long-term, because it takes a long time for approval to come through, right? So even if we wanted to, I couldn't invent and put to market a multiple-use scope tomorrow. So what's the view to that?
We cannot go everything from single use to multiple use overnight because we don't have the logistics for it. So we have to go there slowly and have to go where it counts the most first.
Yeah.
So that's the simple bit. Some stuff we can maybe never go to multiple use. For example, in an ambulance, it's very handy to have single use.
Yeah,
because
that makes sense.
Otherwise you have to have a clean closet where it's air, moisture, and temperature, and cleanliness, and filters and shit like that.
And actually, for those interested in ambulances, we did do an episode with David and Rai from Falk about sustainable ambulances and the conundrum that a sustainable ambulance is and what that works like. So if you're curious about that, go to the Sustainable Healthcare podcast, find the episode with David. There's a lot of good stuff in there. He's really a brilliant mind. But when we're so here we have a practical use for the single-use devices. That you're on the road in an ambulance. It just needs to work and be clean when you take it out. There can be blood and other things coming out of humans inside that ambulance. So it makes a lot of sense. It's a micro portable emergency room.
And the single-use one maybe costs what's that in euros? 200 euros or something like that, and a multiple use one will cost maybe 10,000 euros. So you don't want to be banging that around in an ambulance. No, but so what you can do is you can go from a product to a service, and we are starting up dialogues with the people who are making the single use ones, whether they will be willing to take them back. Because right now we're just putting them in the clinical waste, which is actually not needed, but it doesn't even go to recycling.
No. So the clinical waste is a hazardous waste container, a big yellow plastic bucket that's in a surgical theater. You put everything that's been categorized as hazardous waste into this one, and then it transports a whole bunch of air and different items inside it to an incineration plant where it's
we have 2 in Denmark who are allowed to do this, and the one we are using is in just a good bit south of Copenhagen, so we have to have this cross Denmark, and then it's incinerated at extra high temperature, just to be extra good. So we incinerate it at something like 1800 degrees or something like that by adding diesel to the incineration process. So they literally have nozzles adding diesel to this incineration process. So just incinerating clinical waste equal bad. This is pretty much the takeaway. Yeah. So what we want instead is for them to say, okay, now we use this, we put it back in the box or a bag or whatever, and then we send it back to the producer, and then you take out the bits you can use again. Because there is a video camera in there, there's chips in there, there's wires, guide wires, and none of these things have been in contact with the patient. So that would be sort of a step in the right direction.
So they could either reprocess or go for remanufacture if it's a device that's put together for that. That sounds like a really interesting model. If we're latching on to the LTA or the life cycle assessment, if you had to explain that to a 10-year-old, how would you explain what a life cycle assessment actually is? What does it compose of?
People who know me will laugh. I always use my coffee cup for this one. What is this thing made of? So if I wanted to make an LCA of my coffee cup, I would look into what are the materials that goes into it. So we have some rubber, we have some stainless steel, we have some plastics of different kinds. Where is it produced? Okay, how much energy went into that? The raw materials for the production, where do they come from, and so on and so forth. So we make a complete history of this, from raw materials coming out of the ground or being recycled or whatever, and then until it is back to recycling or thrown in and disposal or incinerated and whatever. And then we'll track all the emissions through that life cycle of the product and add them together, and that would be the CO2 emissions of my cup.
So it's kind of like where you end up having a price for an asset in when it's traded.
Yeah.
Here you basically figure out what are all of the components, what do they add up to.
Yeah.
Is the unit in an LTA always CO2 equivalents, or can it
No,
be
no, no, no,
something
no, no.
else?
No. I mean, when I look at different things, I think the standard method I'm using, I can have 16 different parameters. So there's a lot of different things you can look at. So you can look at the acidification of oceans. You can look at freshwater ecotoxicity. You can look at carcinogenic actions and so on and so forth. Maybe important to add is that when you do an LCA, you have to be sure what you're doing an LCA about.
Mm-hmm.
So you have to define your function. So if it's coffee cup use one time, if that's my function, I'll then do my LCA of my cup, and then I'll divide the emissions from that by the amount of times I use my coffee cup. Add in maybe in the use phase, if I wash this, seldom, then I add that in as an extra step. So when people often forget to when you compare two things, that you compare them on equal basis.
Yeah, so it's on an entire lifetime with
Exactly.
different uses. It's
Yeah.
actually really interesting in procurement. You have two systems where there's the total cost of ownership, where you figure out what's the dollar cost of owning this asset,
Yeah.
and you have the life cycle cost, where you figure out what is the cost during the entire life cycle of this product, and you divide that on different stakeholders. So let's say you buy a big piece of machinery for manufacturing facilities, then you would figure out until the end of life of this machine that we might sell to someone else, then we carry that cost divided upon us. And you can look at an LTA much the same way and say, what is the life cycle cost on various parameters for this asset, distributed on the number of uses and the number of users.
Exactly. And then there is a lot of theoretical discussions, and depending on what you want to use it for, if you sell something on how much of the initial production cost is yours, how much will be theirs, can you even go negative, or can you do whatever? So there's a lot of talk about that. And so maybe just to say one last thing, LCA is not a natural science. It's sort of a bit of a bastard between a natural science and the social science. So you have to, the results of an LCA is a tendency that you then have to look at how it's made in order to interpret that tendency. So when you come out, for example, and you then say, oh, this product has an embedded carbon of this or a CO2 emission of that, and so on and so forth, without knowing how it's done, it's a very hard number to use. And even if you know that number, you can only compare it with other numbers made in the same way.
Yeah. So it will become an apple and pear comparison.
Exactly.
Always.
Very random fruit, and sometimes not a fruit at all.
So the next thing I had written down, I really wanted to ask you is what's a common misconception about LTAs?
Well, I think it's this thing that you just get one number. And then you just latch onto this number and say, this is my number, it's a good number, it's a bad number, it's this. All numbers are made within a system or a certain way of translating emissions of a gas into a CO2 equivalence. What number of years, what do you add in, what do you not add in? I mean, we have an issue right now where biogenic CO2 is not added in because the trees go back. Yeah, sure. My cup lasts for 5 minutes. The tree took 40 years to grow up. So we have an issue.
It's very complicated that we had to involve the dimension of time into this problem.
Yeah, but it is a holistic approach. And when it's not being used as a holistic approach, then it's very bad, because then it becomes an excuse for doing all kinds of stuff. So you really have to think about everything. And if you look into the rule book, you can also see that you have to at least have in all this, significant impacts. You can't have everything, but you can have a lot of it. And when you, for example, look at, I don't know if who made this, Eva Solo, if they have done an LCA of this, would they, for example, have added in their canteen?
Yeah.
Because if I ask a company like you guys or whoever else, oh, we're doing this with canteen, it's like vegetarian food and so on and so forth, but your product, it doesn't come into your product. So there are some things we can look at an LCA of a product, but there's also other things we can't look at. And then we have to make an LCA of a company, or we can make a input-output LCA. It's a different kind of LCA, which then look at the product as part of a company.
Yeah, for sure. That makes a lot of sense in that context. So that brings me on to when we're working with procurement and public tenders, we have seen many examples where suppliers are asked to provide an LCA for the product that they're bringing on. What are requirements that the public sector or that the hospital sector can impose on the suppliers for a positive effect?
Well, we have some. It depends on what you're looking at. I mean, we have the Nordic sustainable packaging, which just goes into how you can package your stuff up, and then we give you points depending on what materials you use and how little you use. You can get more points. With the bronchoscopes, we also made a trial of a tender of that was pulled back for different reasons. But there we just put it out. Now you have to add into this Excel table what is your product made of, and then we make an LCA number or a CO2 emission, and then we compare those to each other. Because, as I said before, the LCAs has to be done in exactly the same way, and you have to look into how they're done in order to use the number. So even if all the companies we have that wants to supply us with product A have all made EPDs, then maybe even the EPDs,
what's an EPD?
The Environmental Product Declaration. That is an LCA made during a certain set of rules, a standard. Even then they might not be comparable when you look into the results. And it also turns out that EPDs made in different countries have different emissions for the same product because they add in different things or take out different things. So when we see an LCA, we get very happy because it means the company is thinking about this stuff. And then we ask for the report, because then we can take their numbers and put them through our model, and then we get a number we can compare with all the other stuff that we buy.
Yeah. So it's basically the calculator has to be running on the same premises for the results to be comparable.
And if I can say one thing, this is the bit where you are a consumer also comes in, because when we are a consumer of everything, I mean, somewhere in our expenses there is a helicopter, and there is buildings, and there is beds, and there is plants, and there is cars, and there is everything else. So when we need to make policy, we need to be able to compare a more sustainable helicopter with a more sustainable syringe.
Yeah, don't you just know when you're shopping helicopters?
Exactly.
None of the suppliers are advertising the sustainable helicopter.
Exactly. But that means that we have to make our own calculation, because the standard for helicopter and the standard for syringe is so different that the results, I mean, it doesn't just say 10,000 times syringe equal helicopter, and you can't do that. So we have to make our own system in order to track this. But it's very important that we do something that's holistic, because otherwise it becomes the calculation forms policy in whether they are available or not. So, now we can calculate for the syringes. Then we have to do something about the syringes. Maybe the helicopter is the big problem, but we can't calculate that. So we just do the syringes. So therefore, it has to be a holistic system that can look into a lot of stuff in one. Otherwise, it becomes determining for what kind of actions we can take.
Of course. If we're so now you've brought up a few examples on the bronchoscopes, and now the syringes and the scissors, the helicopters. I love the helicopter example. Thanks a lot for that. What are examples of requirements that you've seen on a product level? Sustainability requirements.
Well, there's some stuff that we can't. I don't really know what you can say I've seen, because we define out stuff that we don't want, and we have to make it very equal. We really don't want PVC in our products.
And PVC is a certain type of plastic.
Yeah, And the issue with PVC is, and we've had a lot of discussion with the PVC lobby about this, so I be careful what I'm saying, but if it's incinerated with everything else, it makes acid rain, and we don't have a
acid rain. It doesn't have a good cling to it.
No,
it's
no. It's generally seen as a bad thing. It's very recyclable, but we don't have any recycling in Denmark for it. So in theory, it's recyclable. It has to be sent out in order to be recycled. And we will always have some stuff that we can't send for recycling because it's blood, poo, urine, whatever on it. So that'll be incinerated, and that's very bad. And then you can say a long discussion, but we can then say we just don't want this because we don't want the hassle.
Yeah, that makes a lot of sense. Yeah. And if so PVC is one example of a requirement. Then I suppose you have a list of materials that you would rather not purchase as one side of it. Do you have examples of requirements that you are seeing on a corporate entity level?
Well, we have our strategy for what we I mean, there are certain things we won't support, like slavery and yada, 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 the standard package. But otherwise, it's very hard for us to do something on company levels because when we're making a public tender, it has to be on the product level. It has to be this product. So if Evil Core Panda Killers Incorporated are making one very good product, and for the actions we set out, they win, then they win. And then we can maybe say something afterwards with that if you want to sign a contract with us, then you have to live up to these certain things. But other than that, it doesn't leave us a lot of wiggle room in order to do this with companies.
And that has to do with EU regulation, that the tender laws are relatively strict on an EU level, so you cannot impose requirements on a company level when you're purchasing specific items.
Yeah, and there might be workarounds, and people are working with workarounds, but we have a lot of tenders every year, and we have a lot of products to buy, and the process of making a sustainable tender is long and hard and difficult. I mean, the one with the bronchoscopes has been going on for 2 years now, just preparing a tender, and it's still not done, because all kinds of different rules. Very simply, for example, we want to differentiate whether a material is made in a European country or a rest of the world country, because there is a difference if this plastic has been produced in China or if it's been produced in France. Energy mix, where does the oil come from, yada yada yada. But the core rules in a tender will be that you cannot differentiate geographically, and that's sort of a base principle in EU, that you have to be an open market. So if I suddenly come out and say, well, environmentally, if this thing is produced in France, you get 10 points. And if it's produced in outside EU, you get points. That doesn't cling very well. And we have to spend a lot of time defending that, because that is fact.
So it's a very bumpy road to come through.
And we have to work within the data that's available. And there's just not data available from every country and every plant. There is aggregated averages available.
That really makes a lot of sense. So we've talked a bit about what it looks like in practice. We've talked about some of these devices that we have, multiple use and single use devices, and how we might balance, strike a balance in that. There's also some elements to multiple use, expensive multiple use surgical equipment can be rather fragile, and then all of a sudden your LCA runs wild if it's only used once, and then it's so fragile it's broken after one use. We've seen examples of different LCA analysis bringing up different results depending on how many times it's reused, how many times it's washed, what are the conditions that they're putting into the LCA calculation, where there's an unnamed company that made a case for a single-use device, where they basically made an assumption that the single-use device or the multiple-use device would be sterilized and washed in a room that would be taken up and down, and they would only wash one device at a time. So the result came out as if it wouldn't be a very good case. Where of course you could challenge those assumptions and then get a different result.
We need to see the analysis. We see a lot of the stuff coming in from the UK and NHS. They use a UK energy mix. And UK energy mix is not good.
Oh, they have a lot of coal.
Yeah, and then whatever is not coal is gas.
Yeah.
So we have to put it into a Danish context, and we actually have to put it into a local hospital context, because the sterilization central in this hospital will be different than this hospital. So something might be sustainable in hospital A that's not sustainable in hospital B. So we have to make these variables in our calculations and make a Randers model, an Aarhus model, a Horsens model, and so on. But
That makes sense.
it becomes difficult, but once you build the system, it's easier.
So if many of the listeners that we have for the Sustainable Healthcare podcast are tuning in from all over the world, and many of them are tuning in from countries with healthcare systems that are radically different from the Danish healthcare system. So of course the Danish system has the 5 central regions. It's a public healthcare system, and there's a lot of things that are different from the rest of the world. If we have healthcare professionals listening in that want to take action and change the practices for greener ways, what would your advice be for those?
A lot of the stuff is common sense. If it feels wrong, it's probably wrong. I meet a lot of nurses who they are irritated, they are bugged, they are really caring people. The people who become nurses doesn't do it for the salary and doesn't do it for the working hours. They do it because they care. And that kind of person also cares about the environment, because they've heard this is a bad one. And when they're then being asked to take this thing they can say is really, this is a quality product, use it once and throw it out at work, while at the same time at home they're being asked, hey, recycle this piece of plastic, cup, lid, whatever, then they become frustrated. And that's the common sense sort of kicking in. Why I'm throwing this out? Can I do this differently? So I think that's the go-to. And then we try to put out everything publicly when we do analyses and whatever. So if you then need something, you can see if we have it on our webpage, or you can find something from the NHAs. There's also the Aga Khan Foundation who are doing calculation tools. So there's a lot of stuff out there.
So there are places to look, and maybe we can put some of that in the show notes, so it's possible for you, dear listeners, to go in and orient yourself in some of the sources that Rasmus is naming here.
Actually, I think Center for Sustainable Hospitals is just coming out with a catalog of climate activities that has been approved by, the hygiene staff and everything like that. So this is really easy, doable stuff that you can just implement.
So just a solution catalog that you can start applying. I think there'll be a lot of interest about that. We'll see if we can get that into the notes as well. Thanks a lot for coming, Rasmus. This was the last thing I had to ask you. So thank you for contributing with yourself and bringing yourself in here.
Sure.
I really learned a lot from the conversation, so I want to say thank you from the bottom of my heart. And I want to thank you, dear listeners, for tuning in. You have listened to the Sustainable Healthcare podcast by Green Innovation Group. We really appreciate you listening in. We appreciate you liking, subscribing, and sharing. Last year, we was the top 5% most shared podcast on Spotify. So that means that you're all sharing it, probably on LinkedIn and Facebook and similar platforms. So thanks a lot for that. Really appreciate your feedback and you tuning in and you sharing it and distributing this with your friends and colleagues. So this knowledge can go out and have an impact in the real world. So thanks a lot to all of you. Thanks a lot for being here, Rasmus. And thanks to the People's Climate Meeting here in Middelfart.